The objectives of the reference center of the rare disorders of calcium and phosphate metabolism are to improve the diagnosis and the care of the patients affected with these rare disorders. These are rare diseases that affect the level of calcium, the level of phosphate, or the mineralization of bone.
One of the main issues in rare disorders is that they are rare, and so it's important to improve awareness, information and communication around them. That's why in France we are organized in reference networks. The reference network where we belong to is called OSCAR. We created locally a platform of expertise for rare disorders, which is the association of 21 reference centers for rare diseases belonging to this hospital. And the idea behind it is again to improve awareness and share of expertise for rare disorders on a local level. We also work and share information with other centers in Europe, and we belong to two reference centers at the European level, one called EndoRare, so for endocrine rare disorders, and one called BOND for rare bone disorders.
We organize workshops for patients and healthcare providers for one disorder, for X-linked hypophosphatemia. X-linked hypophosphatemia is a rare disease that affects the level of phosphate, and they have a bone deformity and they are handicapped because of their bone deformities. And so what we do is that on one day we have a workshop talk by healthcare providers, doctors, specialists, social worker, dietitian, and then on the next day we have the multidisciplinary team coming and having the clinic with the patient. So this helps to improve the care, and this also helps the communication between the healthcare provider, between the patients themselves, and also between care providers and patients.
I'm an XLH patient. I'm also the father of an XLH girl. In 2011, we created the National XLH Patient Organization. We installed a scientific advisory board populated both with patients and medical experts from the center.
We have a multidisciplinary team with a great collaboration between rheumatologists, endocrinologists, orthopedic surgeon, and rehabilitation physician, and we take care of young patients just after the adolescence, and we take care of older patients.
We have a very important role in the reference center because the children and the adult patients with XLH have very important dental manifestations, and some of them can be really very severe, such as bad abscess and cellulitis. We make a dental examination. We have a dental chair during the workshop, and we make a very thorough examination, and we determine the patient who are in need of urgent dental care. The workshop are a unique opportunity to discuss about the patient's treatment and the patient follow-up with all the medical discipline in charge of this patient.
I especially involved in the management of musculoskeletal symptoms, which are very frequent in patients with XLH. They are very frequent and severe symptoms, include pain due to bone pain, joint pain, or muscle pain. They also have muscle weakness, stiffness, and they have a lot of fatigue. We try to improve using medication and physical rehabilitation. Here in the rehabilitation center, we see some patients with XLH because they need rehabilitation, and we have some type of exercise with a very individual program for each patient.
Isaac, infirmier en endocrinologie pédiatrique de Bicêtre. Ça fait 4 ans que j'ai commencé à travailler ici et c'est mon tout premier poste. Le rôle de l'infirmier dans le service d'endocrinologie pédiatrique est varié, notamment dans le cadre des patients atteints de maladies rares. Nous sommes à l'écoute des patients. Nous faisons énormément de soins techniques tels que les prises de sang ou les bilans urinaires, beaucoup d'éducation thérapeutique. Et nous sommes là quand ils arrivent, on leur explique tout ce qu'il faut pour une bonne prise en charge de l'enfant.
We are involved in research, both at the clinical level by doing clinical trials, but also in fundamental research in all the disorders affecting calcium and phosphate.
We develop a generic protocol of next generation sequencing which is used and very useful for the molecular diagnosis of rare orphan disease, such as phosphate and calcium rare disorders.
So we need to be organized as networks to share expertise, share our research, and be stronger in what we do.